Hi everybody and welcome to Community Conversation here at Atlantic Health System. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health, and today we are going to be talking about all things vaccines, variants, all the services we're providing here at Atlantic Health, covering a broad array of topics. And so who better to do that with us than from my closest left to further out left, our President and CEO, Brian Gragnolati. Brian, thanks for coming back again.
Thank you, Luke.
And Dr. Steven Sheris, he is the Senior Vice President of the Physician Enterprise here at Atlantic Health System, and he is the President of Atlantic Medical Group. Good to see you, sir.
Hey, Luke.
Welcome back to both of you. You've done this before, but for those of our audience who maybe haven't done this before, Dr. Sheris and Brian and I will chat for a little while. We will incorporate some of the questions we received from our audiences ahead of time, which were voluminous, so thank you to everybody who did. But if you have a question about something you hear today, or have been sitting on something for a while and maybe it just pops into your mind, type it into the chat underneath the video there, and we will try to get to as many of those questions as we can as well. It's sort of an interactive conversation between us and you. But if you have to drop out and you miss any portion of this entire conversation will live on our social media channels, on our website, atlantichealth.org, and you can also catch it on our YouTube channel, which we encourage you to subscribe to for all the latest information. So, with all of that having been said, let's jump into it. It has been a very busy 2 weeks in all things vaccines related, COVID care related, and some of the more recent news involves something we got a lot of questions about ahead of time: masking. And so I'd like to start there if we can. Our audience, you may recognize that without speaking too freely, all three of us have been vaccinated, and yet, despite being distanced and in a very large room, we are still wearing masks. And some folks are wondering how important masking still is. If we've gotten however many millions of folks vaccinated in New Jersey, do we still need to be wearing these things? And so, Brian, from a larger sort of public health perspective, I know you sit on a lot of calls with the governor and his team. Why is masking, in your opinion, still something we need to continue to do? And then Dr. Sheris on the clinical side, if you would as well.
You know, we know masking works. You know, and to translate it to something non-COVID, let's look at the flu season this year. We had record low flu numbers. And I would argue it's because of masking and social distancing. So we know that this works with the types of viruses that we're susceptible to. And so until we're at a point where we're sure that we don't need to do this, we need to follow the science and clearly do this. And I think the ambiguity, though, right now is we're getting mixed messages about that. And I know, Steve, that's something you and I have talked about, and there's a lot of confusion out there for people.
Right, you know, we're asking citizens and the public to make decisions on the fly based upon their environment, who they're with, the size of the room they're in, whether they're indoors or outdoors, as to whether or not they should mask. And all along, really, the idea should be that there are two elements to the masking equation, really. It's your personal protection, and personal protection is enhanced by vaccination to a very great degree. You will not get very sick if you do get COVID, and the vaccines are highly effective at even preventing mild COVID. But there's still the possibility that you could harbor the virus in your throat or in your nose and transmit it to others who are not vaccinated and who are vulnerable and can get very sick. So there's your personal protection and then your personal responsibility to others as a public health matter. So when making those decisions on the fly, and again, things are getting complicated, there's a lot of considerations, always take into consideration whether you're indoors or outdoors, who you're with, the distance you can maintain, and the vulnerability of the people you're with. So it's complicated, but it should get better as the virus transmission becomes contained with greater vaccination.
I think sort of a euphemism for a lot of the questions, a catch-all phrase for a lot of these questions around masking is this broad sense of, when do we get back to normal, right? Like, when can I stop wearing masks? When do I have to stop worrying about social distancing? When can I go to a football game in a packed stadium? You know, all of those things. When does life begin to return back to normal? Masking is a big part of that. Vaccines are a huge part of that. Before we dive into the building blocks of how we return to that, is that a palpable sentiment, Brian? When you talk to people around, when you hear from people who are expressing their concerns to you, I'm sure you take a lot of questions around this in your personal life too. Is that a common one? When do we get back to normal, and what does normal look like?
You know, it clearly is the most common question that we get asked. But, you know, I often wonder what a normal is going to look like, 14 or 16 or 18 months from the time that the pandemic has started. You know, I talk to a lot of businesses about reopening. You know, everybody's seeking guidance on how do we reopen, how do we bring people back into the office setting or back into our restaurants. And obviously there's some guidance that comes out, particularly along restaurants, but the real dilemma is in workplaces. But the same part of that conversation is, well, what is that workplace going to need to look like when we come back? Because I think we've learned to adapt. And I know in the medical environment, telehealth is a prime example of that.
Yeah, we've learned, again, it's about protecting the most vulnerable in our population. When this is behind us and when we achieve that level of new normal that you're talking about, Brian, I mean, we're going to be having these same kind of conversations every winter around influenza. You mentioned it before.
Yeah.
And I think you'll see people wearing masks around flu season forever. Now,
I got to tell you, if I'm getting on a plane, I'm wearing a mask.
right.
Vaccinated or otherwise.
Exactly.
even if
Yeah,
you're-
exactly.
Correct, because if you think about normal times, BC before COVID,
Yeah.
nobody wanted to get influenza. Most people opted for the vaccine, was less effective than the COVID vaccines. People are still on their back for 3 days with muscle aches and fevers if you got it. Nobody wants that, so you'll see more masks.
Let's talk about vaccines. Just to catch everybody up on, because we've talked about this a number of times on this program. Here's the update on our process for vaccine distribution. Previously, you signed up for an appointment alert. We sent you an appointment alert. You then scheduled at a time where it worked for you. With the increase in eligibility, which the state has done recently, we have changed how we are scheduling those appointments. Right now, it's as easy as it's ever been. Go to our website, and you will click on the COVID-19 vaccine section right on the homepage there. And the button now, which used to say, schedule or get a scheduling alert, now says schedule an appointment, right? So you go, you will see a list of locations that have available appointments. You select it, you answer a couple questions, you set up yourself an appointment, you come in and get vaccinated. Brian, you were at our location in Rockaway recently, and you saw the process. Encouraging to still see a lot of people getting vaccinated, still taking advantage of this eligibility, particularly young people. What's your reaction when you see folks getting out there and doing it?
I think it's great. The Rockaway site, the mega site, that a lot of people have been vaccinated at, works really well. And it's very smooth. This was on Sunday, you and I were there. Literally, every person you encountered talked about how easy it was. And it's even easier now because you can get an appointment there almost the same day or maybe within a couple of days. And that's a big change. So those of you that might have been reluctant because you didn't want to kind of go through this two-step process, you didn't want to wait, you can get it now. And I'd encourage you to do so.
Dr. Sheris, one of the things that a lot of folks have talked about is, because I want to get into a couple of these questions that were submitted ahead of time. Who's appropriate for vaccine, or should we be getting vaccinated? Some of the questions we got are around things like allergies, right? Anna wants to know, is it safe for somebody who has egg allergies as well as other allergies to food and medication to get vaccinated, and should they choose one type of vaccine over another? What's some general information for Anna?
Well, I'll give you the general vaccine guidance that we give to all patients, which is if you've had a reaction to a vaccine before, then you should talk to your doctor about vaccination, okay? If you've had a reaction to a vaccine, and that's an anaphylactic reaction, lip swelling, difficulty breathing, wheezing, that's the big reaction. Not muscle soreness, not achiness, that's pretty much normal for vaccines. Related to the egg allergy that exists for influenza vaccines because of the way the vaccine is developed, that's not the way these vaccines are developed. Right. So egg allergy is not a contraindication to the vaccine. But in all cases, and this is what we're careful about in this environment, is you got to talk to your own doctor about your own situation always. We don't practice medicine by Facebook or by telephone. So.
And Dr. Sheris, that's a great point, because for all those folks who did submit very personal questions about their specific situation, their specific health need, to Dr. Sheris's point, the best conversation is between you and your doctor. We'll try to get to as many of the relevant ones as we can, but but some of those are a little far afield. A lot of the questions are around something that, Brian, we can talk a little bit about as it relates to vaccinating high school and college seniors. Some folks are wondering, hey, great, 16 and up, that's awesome. What about 14, 15, 12-year-olds? We're still waiting on guidance from the pharmaceutical companies around that, right? That's not an eligible criteria
waiting
yet.
for guidance from the government.
From the government.
On that, in terms of how the vaccines are approved. And what everybody needs to understand is that those trials are still underway right now, and we will be getting guidance as it emerges. And I was listening to some of the leaders at the federal government yesterday, and we expect to be able to continue to reduce the age over the next 6 months. And so I think it's pretty reasonable that within the next several months you're going to continue to see this titrate down to a point where most kids are going to be eligible, which is going to be good because getting kids back to school is very important. We're doing our part with the teachers and the school staff. We've given out thousands and thousands of vaccinations to the people who work there. And now in the high schools, you're going to begin to see kids getting vaccinated. But this next cohort is going to be important.
Yeah, the data for the Pfizer trial in 12 to 16 has been, I think, submitted to the FDA, and they're reviewing that. And there are clinical trials underway for kids between ages 2 and 12. So that should follow in that order. So to that point about people are going to be thinking about the fall school year and our role in vaccinating kids, that's going to be the next big wave, I believe, of vaccination.
We are doing, for graduating seniors on the high school level, and some of you may have seen some coverage around this in the media, we are partnering with all the counties and districts in the areas in which we operate to help those graduating seniors get vaccinated. Brian, why are we leaning in on that? There are thousands of people who we've helped get vaccinated. Why is this specific group so important to us, and why are we partnering with the counties on getting this done?
Well, let's think about where we are. So we started this vaccine, and again, to remind everybody, the fact that we have these vaccines that are so effective in the period of time that they were developed is amazing to me. And so that's been the incredible story here, and we should never lose sight of that. But at the very beginning, we had some very strict criteria on who could get this. And remember, it started out with people who were in long-term care facilities and people with pre-existing conditions over a certain age. And those guidelines were pretty rigid. But I got to tell you, from a hospital's perspective, we've seen during this latest surge, we've not seen a lot of folks from the long-term care facilities coming in. So the vaccine, that strategy to get the most vulnerable, worked. And then we've gone through different iterations of who was available, plus we were dealing with a shortage of vaccine. So we had kind of a perfect condition to create a lot of queuing and dilemma. But now that we've got broad guidelines about who can get the vaccine, we've put out so much vaccine to date, and now we have more vaccine being developed. We're at a point where we have enough capacity to really create some choice. We're also at that last mile part of this, because about half of the country has had one vaccine eligible people, about half of the state has that, but things are slowing down. The pace of vaccination is slowing down. So whatever we can do to stimulate interest to get people vaccinated. So the idea that came up from one of the Morris County commissioners about doing this around graduation was an awesome idea because it'll create some buzz, it'll create work on social media, and if we can get people to see a reward for getting vaccinated, that's a good thing. So even in the words that President Biden began to use yesterday and will continue tonight, I'm sure, in his address, it's going to be about what you can gain by taking the vaccine. Right. And in this instance, graduation parties. You can have your grandma there, you can have your grandpa there, you can have your mother and father and your whole family there. But it's a great opportunity to say, hey, everybody needs to get vaccinated. If you're not vaccinated yet, let's get vaccinated.
It's important to pivot the conversation away from the stick to the carrots.
Right.
And that's what Brian's talking about. You know, a lot of the conversation has been co-opted by vaccine passports and excluding people and doing that. I think the governor and the president have chosen the opposite. What can you gain from being vaccinated, to Brian's point? And I think that's a healthy conversation. Having, you know, observed this, and this really, although the weeks seem like months and the months seem like years in this process, the situation on the ground really changes week to week. So there's a lot of vaccine supply. There's a little bit waning demand. Still, our weekly shipments are unpredictable. And that makes it, that gets translated into some frustration on the part of the public, even with their choice of vaccine appointments.
Right.
So there's still a little bit of clunkiness in the system, but things are actually moving in a positive direction. As we predicted,
Right.
we said there would be a flip between demand and supply, and we're beginning to get to that point. It really is, to your point, I agree, Brian, about that last mile now.
Yeah.
We've got to convince everybody it's the right thing to do for everybody around you. It's the right thing to get us to the new normal, to answer that question, to get us to a safe place where we can all be together again.
You know, and this is where I'd like to engage the community that we've got available to us today to give us some ideas. So we talked about this idea of, you know, graduating seniors, whether high school or college. It came from one of the county commissioners.
Yep.
What ideas do you all have that could help us think of different ways to reach populations that haven't been vaccinated? Because, you know, people, you got that I'm never going to be vaccinated group that are going to be hard to get to. But you got this whole group in the middle that's not yet vaccinated that might be on the fence for a variety of reasons. Give us some ideas about how we can reach out and create some buzz about this, all within the spirit of what is this going to then get for you?
So I'll challenge you, Brian. So you've had teenagers. This is the hardest group. They think they're invulnerable, correct?
Correct.
And they want to do it their way. And this is the next big group. That's where the virus is transmitting now, at these outside high school parties, and that's where these social engagements, right? So I don't know. I'm appealing to, like you, to all the parents out there. How do we get through to our teenagers?
Yeah, my 8-year-old isn't quite there yet, but she'll be there before we know it.
You know, I'm thinking about, you know, I sat at so many sporting sidelines over the years with my kids. I'm thinking about that. I was talking to you guys. So we have an ice cream truck now that we move around to places to administer vaccine. We've got a mobile van. You know, do we set this stuff up at soccer tournaments or lacrosse tournaments? I mean, there's a variety of different things we can do, and it would be great to hear from all of you ideas that you have to help us get the vaccine out.
So here's how you can put them in there. Add them into the chat thread, same place you would add questions or comments. You can also go to our website. There's a feedback form through our info process where you can send us commentary and questions. If you got a great idea, submit it there too. You can see that the link to that on our website, atlantichealth.org. And look, Brian, to your point, nobody's got a monopoly on good ideas, so we never know where they could come from.
If you're a community leader or leader of people, and you know, contact us, we'll figure it out. If you get a group of people together who need to be vaccinated, dozens, hundreds of people will make it work.
Yeah, we've been doing that with churches. I know we just did something, we're in the process of doing something with the Hispanic Chamber of Commerce in Morris County. Again, you guys are the influencers. This is the last mile, and that's the way we're going to get back to a new normal.
A couple questions that have come in live. Bob on Facebook wants to know about boosters. What do we know at this point about whether or not booster shots will be needed? And the follow-up question presumably is, will Atlantic Health System be involved? Whatever that ends up being, will we be involved in that process?
So let me take the second question so that I don't mess up the answer to the first question. But we're in the business of taking care of the communities and providing whatever the communities need. We're going to be working on COVID for as long as I can see in front of us. And so we're going to be in this vaccine business forever until we don't need to be anymore. So in that context, then I'll let Dr. Sheris actually answer the question, because I have an answer, but it might not be right.
About immunity?
No,
about boosters.
That's what I mean.
Think will be
So that's what.
needing?
So it speaks to immunity. So how durable is the response from the current vaccines? So they've only been in circulation and evaluated since early last fall. But every time they analyze the data, they see persistent protection. So we're out now to definitely 6 months, but that's as far as we've measured. So every time we've measured it, it's been yes. So what do we know about the immune response? Well, everybody's concerned about, do I have antibodies? Well, antibodies are only a signal of immunity. They're not the complete be-all and end-all of long-lasting immunity. Antibody-related immunity naturally wanes over time. But the responsibility for conferring protection is transferred to specialized white blood cells called T cells.
Right.
Those are called memory T cells, which present the virus to the killer T cells. There are specific T cells, memory T cells, that will recognize the spike protein, and they persist for a long period of time. How long that is, we don't know. And interestingly, in Atlantic, and you know this, one of our early research efforts was towards identifying the responsible memory T cell, which we were able to do in partner with our industry partners, a study led by Dr. Eric Whitman here. And early on, we have identified that. Now, it's not in clinical use. It's not in commercial use. We can't tell whether you have that T cell. But all the indications are is that the response is durable. Second part of the question. As long as the virus is transmitting worldwide, amongst people, worldwide, outside the United States, India, 350,000 cases a day. Horrible situation there. Every time the virus passes, it has the opportunity to change or vary and develop a variant. If there's enough virus transmission that continues worldwide, eventually there may be development of a variant that escapes the immune response. That's why this is the ultimate worldwide team effort. It's not just Atlantic, New Jersey, US. It is worldwide. It's in all of our best interests to get the pandemic, the worldwide pandemic, under control so we can see the virus transmission go away, and with that, the development of variants that can escape immune transmission.
So as it relates to a booster, my guess, based on what I know, is there will probably be the need for a booster, and we'll be here for our community to help provide that.
Dr. Sheris touched on variants. And I understand the importance of getting those vaccines distributed to get in front of the potentiality of variables and variants. But variants are already here to an extent. We know there's a UK variant, there was a Brazil variant, there was a South African variant, and there are others developing all the time. Why is it important that we are able to identify where those things exist, and what are we doing as a system to be able to identify those variants as they come up? Brian?
But you say we know there are variants, which we do, but we don't know really the magnitude of the variants because we're not doing the testing. If you look at the state of New Jersey right now, about 3% of positive tests are having a subsequent variant analysis done on them. Here at Atlantic, we've stood up over the last 3 weeks or so the ability to do testing on 100% of our positive tests. And we do all of our tests internally now to do that. And we're in the process of now feeding that into the state. And we're doing that along with a couple of other health systems. So hopefully we can get those numbers up to get a real understanding of what those variants are. But it doesn't affect the diagnostic piece of this. You either have COVID or you don't. And that's
And it doesn't affect the treatments either. The treatments are the same. It enables us to create this map of transmission if you do enough of the variant testing. The vaccines are effective against the variants that are out there now. That's the message here. So you don't have to worry about that. But you do, again, it speaks to the original question here about the purpose of masking and distancing and all these considerations. You know, the common answer that I get when I ask people to wear a mask indoors that I don't know that I'm sharing space with is, well, I'm vaccinated. And then I go through the much shorter explanation than we have explained here. I said, well, that's really nice, you know, and I say I'm Jewish, and it doesn't really, that's irrelevant information that you're vaccinated.
No more or less relevant.
Right, it's no more, no less relevant. It's because of what you can transmit to others is why you should be wearing a mask. Same thing with the idea of variants. You should not be concerned about that if you're following all the rules here. And
so once you have that conversation, do people buy you a drink?
No, they didn't. No, they just
They throw a drink at you?
They learn very quickly what you have learned, that I'm just a wise guy at heart.
No, but in all
Yeah.
seriousness, that's really an important piece of all of this. And so the work we're doing on variants will help
Yeah,
the
understand
overall
it.
efforts of understanding the virus. And I think it's very important that a lot of us are making those investments in variant testing.
Yeah, and I got to hand it to our laboratory
yeah.
scientists here at Atlantic.
Yeah.
13 months ago, we spoke about testing.
Right.
Now we're talking about advanced testing. Without these folks, over the last 13 months here in Atlantic, we would have been flying in the blind,
Yeah.
literally. So they don't get the credit that they deserve
Yeah, absolutely.
in beating back this pandemic.
Yeah, the scientists in our lab are really unsung heroes. They really are.
I am pleased to share that we have already gotten some suggestions around how we can help get vaccine out there. Some of them have come from things that we're sort of already a little involved in. Amita says, get those vaccine trucks out there, so delivering it into the community. Mary suggesting both senior and junior proms maybe could have a vaccine component around them as well. And then Lauren is suggesting perhaps spring festivals for vaccines, using the idea of gathering in person as an opportunity to get people vaccinated. So thank you so much to everybody who's submitting those. We're going to start getting that list together, and those are things we can effectuate with our community partners.
And keep them coming in. Keep the ideas coming in.
A couple of things we want to touch on. Let me do one or two more of these quick, easy questions that have come in that I think, Dr. Sheris, you can handle. Did we talk about the need for, if you've been vaccinated and you've waited your 2 full weeks, is it okay to take Advil, Aleve, other types of painkillers for when you have general pain? Is that okay?
Yes, and yes to the broader question. This whole question about taking Tylenol around the time of the vaccine and affecting the response, that's never been shown. So if you feel achy after you've gotten your vaccine, you can take Advil, you can take Tylenol. That's not the way immunity is developed related to the anti-inflammatory effects of Advil. And Tylenol does not have anti-inflammatory effects. It's just a painkiller, an antipyretic, anti-fever medicine.
Here's one that popped up that even I can answer. The question is, can I choose which vaccine I would like to get at Atlantic Health System? Right now, when you schedule an appointment for a vaccine, and look, I'm presuming you're over the age of 18, we're not allowing folks to select specifically which vaccine they want. If you're 16, you have to get a specific vaccine. So that's a bit of a different story. The scheduling process will move you through in a way that ensures you get a vaccine that is appropriate for your age group. But we appreciate the question, but right now we are scheduling appointments by time and location, not by specific vaccines.
And my advice to my family members is if you can get a vaccine, get a vaccine. You don't need to be discerning about that. Now, the J&J vaccine,
Yeah, that's a good
obviously,
point. Yep.
we've had some additional guidance on that.
Yeah, that specifically has not been written yet by the CDC, and what we're told is the guidance that's going to come about as a result of the pause in the J&J vaccine is going to center around how physicians recognize and address and treat, and what medications to use, and more importantly, not to use if those clotting complications do occur. But remember, they evaluated 9 cases out of 7 million vaccines.
Right.
And I'm told that's the equivalent chance of getting hit by lightning twice.
Right.
Wow.
In terms of chances.
We have just a few moments left, and I want to touch on something that we've talked about a lot in previous community conversations, but haven't yet touched on this one. And that is what we have seen in the community in terms of people caring for themselves and seeking the care that they need. It sounds like from what we've seen over the last few weeks that we have seen a level of re-engagement with healthcare that is heartwarming, that is encouraging to see. But undoubtedly there are folks out there who are saying, you know what, maybe I'll push it off a little longer, maybe I'll get vaccinated first and then I'll go at some point. What's our message in terms of how we're delivering care to those community members who need us right now, both at our medical centers and at our physicians' offices? What's our guidance to them about seeking care, and what's the current state as it relates to the COVID volume we're seeing in our hospitals right now? For whoever wants to go first.
Well, we're actually have exceeded our pre-COVID volumes in terms of people coming to the office. And if there's still people out there who have delayed screening or preventive care or chronic care management and have been feeling well and thought they could put it off. It's time to come back to the office and re-engage with the healthcare system. It's perfectly safe, as that has always been, to seek care. You don't want to push that off at the risk of developing complications down the road. People with symptoms have been coming in, and we have been open for business for 14 months through the pandemic and seeing those folks. But again, if you're delaying care, get back with your doctor. Whether it's an AMG doctor or anybody else, it's important that you get preventive and screening care.
You know, in terms of our hospitals, you know, we have continued to care for COVID patients. It's been kind of plateauing at a level and then going down and then continuing to do that. And that's going to be the case for the foreseeable future. But as I round in our hospitals and talk to our team members, you know, we continue to provide very safe care. We've got the process of care down in a very good way. We've got specific units that house COVID patients, so we're not mixing patient populations, so people should feel safe about that. And then the procedural areas all have very strict and rigid protocols to make sure that everybody stays safe. And to Steve's point, while we're seeing a lot of our office volumes pick up, at the same time, we're seeing our hospital volumes pick up with elective surgeries, a lot of ambulatory care, and also, you know, some of the people that have delayed care, we're seeing the consequence of that, and those folks are coming in sicker, and you know, that's unfortunate. So don't get behind in your preventative care. Engage in the system, and we're there to serve you.
Folks, we are just about out of time, and so I want to thank Dr. Sheris and Brian for joining us for this conversation today. I know there are a couple questions that we didn't get a chance to get to. There's questions about monoclonal antibody treatments, questions about how soon visitation rules and things may adjust. We're going to continue to try to get to as many of those as we can offline. We'll try to post material on our Facebook page. First and foremost, if there's something that you didn't get a chance to ask, you'll find that our website has a ton of information on it. I strongly encourage you to go to atlantichealth.org, poke around on there, and send us a question through social media if you don't see an answer to something that you're curious about there. But we'll try to, again, answer all those questions, since information transfer is a huge part of what we do.
Can I have one last?
By all, hey, of course, yeah.
You know, we appreciate all the suggestions you gave us today. And to me, that's the key to getting back to normal, is engaging on this. Having these conversations with your friends and family members that might be reluctant about getting a vaccine. I know I went to pick up my dry cleaning the other day and was talking to a young man who works there who we helped get a vaccination for, he and his family. And now he's convincing his mom and dad to get it. He got all his brothers and sisters. And I said, well, if we can just, we'll talk to your parents. We'll get somebody that can help. And that's really, that kind of engagement is what's going to get us through this. So thank you for your engagement, for sitting through this and listening to Dr. Sheris and me. Luke's a pro at this, we're not. But more importantly, thank you for being engaged, because, you know, our ability to get back to normal is directly in your hands.
Well said. Thank you, Brian. Thank you, Dr. Sheris. All right, folks. We'll see you next time.